to do brushing teeth this morning. Tooth assist. All right, ready? Yeah. Ready? We're gonna get everybody with the cat. So you're gonna brush the patient's teeth. You're really going to brush someone's teeth that day. So you need to have your own toothbrush and your own toothpaste. Carry it with you. You go to the 99 cents and you get one of them traveling cases. It comes with the little toothbrush and the little thing of toothpaste. And you bring it with you, have it in your thing. Also have a big bottle of water so you could rinse out your mouth with water. You don't want to use the tap water for that. Alright, so you're going to knock on the door. You're going to introduce yourself, name and title. You're going to address the patient by name and let the patient know you're here to brush their teeth. After that, she's going to tell you, okay, you're going to go do hand washing technique. After you do hand washing technique, you're going to come back and ask the client if she got an arm, because this arm got an arm. You check the ID band to make sure that he or she is the correct client that you're supposed to render the skill upon to. After that, you're going to go, gather your equipment, provide the privacy, lock the wheels, raise the bed, and sit the client up in the bed, 45 to 60 degree angle. Okay? 45 to 60 degree angle. You're going to bring the equipment. I'll place it in front of them. You're going to take a face cloth and you're going to place it on the chest. This is to avoid getting the patient wet, and it's going to help with drying them after the procedure. You're going to have toothpaste, toothbrush, cup of water, Emerson basin or kidney basin because it's shaped like a kidney, right? I have the dentures here to show you how to brush the teeth, but this is not denture care. The teeth are just here to show you, because as you can see, she has no teeth in her mouth. So this is just to show. Alright? And I have a washcloth here. This is to help me pat dry her mouth during the procedure. This is a glove skill. Gloves are needed. Why? Because you're dealing with a body fluid, which is the saliva. And when you brush people's teeth sometimes, what? The gums bleed. And if there's presence of what? Blood, there can be presence of hepatitis or HIV. Alright, so precautions, safety precautions. So the patient's sitting up, we're going to start. You're going to start with what? You're going to start with the upper teeth first. Alright? Before you start actually brushing, you're going to take some water and you're going to wet the bristles of the toothbrush so the toothbrush bristles can be softened. Okay? You're going to add some toothpaste and you're going to begin the brushing technique. These are the top teeth, right, that are in the mouth. You're going to start in the middle and you're going to brush up and down. Not like this. Okay? Your enamel runs what? Horizontal or vertical. This is horizontal, right? Your enamel is vertical. So if you brush this way, you do not clean your enamel. You're doing nothing. You have to brush up and down. So you have to brush up and down. You're going to start in the middle and work your way to the back. Right? Then you have to do underneath, which is the molars. The back teeth are the ones that crush up and break up all the food. Right? Then you got to go inside. Inside. So you have to brush all the surfaces of the teeth. So you're brushing this way, this way, this way, this way, this way, this way. Then underneath, right? And then inside. Inside. You have to brush all the surfaces of the teeth. Okay? After you brush all the surfaces of the teeth on that side, you start with the farthest side of the mouth first. You're going to bring the basin, the cup of water. She's going to sip. She's going to gargle, and she's going to spit that out. And with this, you're going to pat. Right? Because when you spit, you know the saliva be in. Right. Right? Okay. Now we're going to do the closest side to you. Right? You're going to ask the patient to open up the mouth as wide as they can, and you're going to brush, 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 brush. Underneath. Right? And inside. The toothbrush down, bring the basin, bring the water, she sips, she gargles, she spit, and you pat dry. That's the top. Now we got to do the bottom. The bottom is easier than the top. The top you have to sometimes hold the lip, tell her to open wide. You got to look upward. Be careful that you're not in the line of fire. Because when you go like this, that stuff sprays out, could go in your eyes. So no. So stay a little distance so you don't get that in. So now, we're going to do the bottom teeth. These are the bottom teeth, right? Same theory. You might have to put more toothpaste. You might have to rinse it off, right? You're going to start in the middle, up and down, 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 up and down. Then the top of the teeth, the molars, right? It's easier at the bottom because you can see what you're doing. The top you can't really see. Then the inside. Basin, water, sip, she gargles, she spit, you pat dry. Now this side, the closest side to you. Same thing. Up and down, 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 up and down. Top, molars. Inside. Right. Bring the basin. Bring the straw. She sips, she gargles, she spits, you pat dry. The last thing you're going to wash is the tongue. So you ask the patient to open wide. Here's the tongue of the mannequin. You're going to go into the middle of the tongue, and you're going to wipe outward. So this is the tongue, right? Sticking out. You're going to go from the middle, and you're going to wipe out. Depending how large the tongue is or how wide the tongue is, will depend how many times you have to swoop the tongue. Usually twice will be good enough. Okay? So you wipe down the tongue. Same thing. You bring the basin, bring the water. She sips, she gargles, she spit. You pat dry. Ask the client how they're feeling, if they're feeling okay. Make sure she's nice and dry with this face cloth. Get this out the way. You can remove your gloves at this point. Get this out the way. Lay the patient back down. Definitely lower the bed. And then we got to deal with the equipment, right? You're going to put on fresh new gloves. Fresh new gloves. All this stuff is going to go in the hamper, right? This stuff is going to go in the commode. You got new gloves on. This goes in the commode. You got tissue. You turn on the water, warm water. Get some water, commode. Water, soap, wash over the commode, in the commode. Water, rinse that soap, in the commode. The last water, in the sink. You're going to dry it. If this has to be cleaned off, you clean it off. If this has to be rinsed off, you rinse it off. This is personal equipment. This is going to go in her drawer. This goes in the garbage. The chuck goes in the garbage. You remove your gloves. You do hand washing technique. You come back, you make sure that the client is okay, and tell the proctor that the skill is complete. Any questions on this so far?